So, understanding depression in North Carolina, presented by myself, nurse practitioner Jessica Brooks, your mental health advocate, empowering women through awareness and support. Let's see. Next slide. Understanding depression's impact. Depression affects many, particularly women facing unique challenges such as those with postpartum issues or significant stressors in life. And I will be looking at my notes because I do have some. If you are new here, I do um, use notes sometimes. So, some risk factors for depression in women are being female, of one with our hormone changes, psychosocial stressors, so that's our environment, um, physical or chronic illness can be a risk factor, history of depression, postpartum, as I stated earlier, a family history of depression, and alcohol, substance abuse, or significant loss, suffering significant loss during that time can cause depression. Some alternative treatments we can use are mindfulness and meditation practices. These techniques can reduce stress levels significantly. So, just taking the time to ourselves to make sure that we gather ourselves mentally can help um, with depression. Also, identifying things that are important in this area are to identify, make this come down a little bit, to identify suicidal ideation, which is very important, which is important for safety issues. And if you are someone else that may be having these thoughts of suicide or contacting emergency teams is really the way to go to make sure that you have people around you that can keep you safe during that time, as well as the sleep hygiene. So, making sure you go to bed and sleep every day at the same time. You want to decrease the use of blue light, so phones, television right before bed. Maybe read a book or journal a little bit. That'll help with sleep hygiene. Home safety. So if you have weapons in the home, where you want to make sure they are locked away and they're safe, as well as counseling can help. There since COVID, there's been a lot of people that are embarking in counseling now, especially of Black Americans. So that's a good thing. If you see and know that you are in need of professional help, seek that help. And you want to avoid things that trigger you to go into depression as well. So your nutrition, a balanced diet may improve your mood and energy, as well as making sure that you're getting the proper nutrients. So in this area, I would say you may want to check in with your primary care provider, making sure that your levels, for um, like your vitamin levels, things of that nature, are intact. Because sometimes it may not be full depression. It may be that your um, vitamin levels, like vitamin D, is a very common one, especially with us being inside more often than we probably should and not getting out in the sun. And so things of that nature. So you want to have them to check your labs, make sure that you're not deficient in any of your vitamins to make sure that's not what's causing the depression symptoms. Exercise, it helps to helps depression because it releases endorphins, our feel good hormones, which help us to feel rejuvenated. A lot of times you may feel like you can take on the world after a good exercise routine. So making sure that you make that part of your daily um, regimen, especially if you are or have some of the risk factors for depression. So making sure that that helps you to stay in front of it at all times. Okay. And in the event that it may not be, deficiency in vitamins or the alternative treatments may not be working, you can work with healthcare providers, whether that is your primary care or a mental health provider, to use pharmacological treatments. With that, the treatment usually will be for 4 to 9 months. Um, no, I'm sorry, correct myself. So you will use these medications and you will continue them for 4 to 9 months after the symptoms have resolved, just to make sure that they stay in relapse or prevent relapse. So some of the medications that we have on our PowerPoint are citalopram, Lexapro. There's many more out there that can be used. Citalopram is used a lot of times for treating depression symptoms, and you get Lexapro or others like Lexapro help in reducing anxiety and depression. And like I said, there's many other medications that are used. These are some of the more common ones that we see or that we prescribe. Hotline resources. So this is very important. And I only put the national helpline because it's the same no matter where you are. So we have the national helpline. It is open and available to all people 24 hours a day. And the phone number is here, 866-629-4564, if you feel like you need help or a loved one needs help. There are also should be local services that you can research in your area, tech support, and crisis centers as well. Those are all local. Suicidal ideation is one of the main things with depression that need to be watched out for, and emergency care should be sought as quick as possible. So, if you are or a loved one are experiencing symptoms like expressing feelings of hopelessness, talking about wanting to die, um, or talking about wanting to be unalive, increased substance abuse or withdrawal, significant changes in behavior. So they may be um, very outgoing, and then you start noticing they kind of started secluding themselves, things of that nature, whatever the opposite is of what they normally are. Withdrawal from family or friends, talking about feeling trapped or in pain, sudden calmness after extreme distress, declining interest in daily activities. So things that they normally enjoy, now they no longer want to do those things or care for those things. Those are things to watch out for. An emotional pain that feels unbearable. So making sure that we check in with our people, as we always say on, as many people say on, what I see it on like social media, they say check in with your people if something's going on, right? So yourself included. All right. So thank you. Make sure that if you are in need, you can reach out for a professional help. My information is in the bottom of this page. Also, should be a link in my bio to my website, to where if you need to book an appointment, whether it's telehealth or in person, you can do so. And I'm here and available to help you with any condition that you may have. Okay. So thank you again for listening. And I hope this helps someone, or you can pass it on to someone that may need it. All right. Bye.